That is not what I've ever seen in the Dr.K and Reckful interviews. This is just completely random. Like, obviously, a psychiatrist, a therapist is still a human being, and of course they have their own emotions. But those kinds of things happening should be ringing alarm bells in their head of like, what? Okay, this is allegedly didn't start off as therapy. The relationship started off as two Twitch streamers having a discussion on Twitch of not therapy, and that's where the whole debate is about. It's not clear cut. Take it as a conversation with a professional therapist because he's in the field. People take it that way because there is an argument to be made that he's taking away the stigma from that's around mental health that we all have, that still exists, and helping break it down, and that is positive. But I don't know if you can, even when people feel helped by talking to him on stream, I would feel really uncomfortable. I would love to talk to him, but I would not walk away thinking like, wow, that was a good session. Like, it's okay. So this is exactly what I was talking about. Dr. K himself, after that 2 years thing, recognized it was a mistake, and here he's admitting it, and he's trying to walk it back. The point of what we just saw, that was to show that certain people believe that he's acting and that he's doing it for clout.
That's what happens.
Wait, what the why?
The new stream by Harvard psychiatrist Dr. Kanoja. It's really cool. He helps gamers on stream. I'd love to have a conversation with him. He's starting nowish. Yeah, I would talk to him. That sounds interesting. Should I try to talk to him right now?
Who is Reckful?
Oh shit.
Yeah, sure. We can talk to Reckful. So tell me, what are we talking about today, buddy?
Wait. Is that... He had 57 viewers back then? Like, did he... Oh, yeah, he just started streaming like 10 seconds ago. Okay, yeah, then that makes sense.
We can talk to Reckful. So tell me, what are we talking about today, buddy?
Well,
am I calling you Reckful?
You can call me Byron if you want.
What do you
yeah, I've dealt with depression my whole life, pretty much. I mean, since I was like 14, and I'm 30 now.
Okay.
And a bunch of people in my chat were telling me I should call you.
Okay.
So here I am.
And by the way, so a couple of ground rules. So I'm a psychiatrist, but I can't treat your depression over the internet.
Yeah,
unfortunately.
Gotcha.
And then the other thing is I tend to ask a lot of questions. If there's anything that you don't feel comfortable answering, just don't answer it. And just let me know.
Okay.
So tell me, what do you mean by depression? Let's start there.
Well, I've been diagnosed with bipolar type 2. And when I was 6, my brother killed himself. He also had it.
How old was he?
He was 21. It's a very big age gap.
Okay.
And then because of that, when I've gone to get treated, they never give me SSRIs. I've never tried an SSRI because he's tried an SSRI, and then that's.
I believe that life. What do you think of? What's your sense of like what life is?
For the cockshroom, stay for the bed guy. Exactly.
I'm
actually, yeah,
organism
let's
that
keep the cockshroom up.
Came to be from 2 other organisms who liked each other enough to have a baby.
Yeah. So what does that mean? Like, what do you think about your life? Like,
how do you make
like your life
babies?
has purpose?
Can you explain?
Most of the time, no. But recently, I've started to think yes, because I realized I can start trying to help other people who have had my same problems, so I relate to them. And then I hope by making this game I'm working on that they can find friendship and a sense of community. Because I'm making an MMO.
Reality actually exists as a probability. Like, reality is not static, in that the act of observation causes a probability to collapse into a reality. So like the world exists as a probability waveform, and when you observe something, that probability disappears and it becomes a reality. When your depression acts up, and I want you to understand that depression is like a pattern of thinking within your mind, it takes the things that you know and distorts them. So it takes the fact, it hijacks this idea that you know that the world is like not a real place in some sense, and then it sort of makes you feel like there's no purpose because nothing is real. But let's talk a little bit more about depression today. So tell me what your experience of depression is.
Okay, it's very hard to explain. The easiest way to explain is I've had years of my life like this where I wake up every day and I don't see a purpose to doing anything.
Okay.
I don't see a purpose to getting out of bed. I don't care if I stream or don't, or if I go eat or don't. At some point I get really hungry and I'm like, okay, I guess I have, like, I feel like it forces me to kind of, you know?
Yeah.
But I don't really care one way or the other. And then I start to think I don't care if when I go to sleep, I don't care if I wake up. I prefer not to. Actually, the sleeping was the most peaceful part of my day.
Okay. And how long would this, how long would this stretch last?
Relate to that.
Years.
So I think this is a really common misconception. I think you may have clinical depression, but I think what you're describing is not clinical depression. So I'm going to explain to you guys what clinical depression is. I think your problem is that your life is empty. That's different. And in fact, that's what we were going to talk to the other person about today, and we will. So I got a bunch of questions about this because...
Wait, so you're saying you think I was diagnosed incorrectly when I said I have bipolar
You may
disorder?
have depression on top of that, but what I want you to understand is that like there are different flavors of depression. One of them is a biological, organic, neurochemical kind of thing. And what I'm hearing from... but there are certain features of that you don't really fit that bill. So I'm going to describe what that is. So you may be depressed on top of being unhappy or having a life without purpose. But those are two independent things. So tell me a little bit about, so it doesn't sound like, I'm not hearing anything about depression when you were in high school. You said 14, but you're not describing anything to me that.
Oh, yeah, no, because it's hard for me to really dig deep and remember. I mean, I remember I listened to a lot of sad music. I was idolizing a lot of people who killed, I was idolizing a lot of people who killed themselves at the time, because I was listening to like Nirvana and then Elliott Smith and then, I don't know, a bunch of other, I can't remember. But,
I mean, it sounds like you were emo.
Yeah, it could be. Yeah, I know. But the lyrics were very relatable to me.
I'm kind of digging around.
So I know that this is one of the things some people like critics of Dr.K have brought up specifically concerning the what happened with Reckful, that that Dr.K was basically like convinced him of a different diagnosis than what he thought was the diagnosis, and basically misdiagnosed him, and that he has some responsibility there. I guess that's why MrGirl is showing this this clip. I'm not. I will probably have an explanation afterwards. I'm not sure.
And you're not expected, like, I don't remember much about when I was 14. Like, you know, people don't really remember much about when they're 14. And that's okay. It's just, I'm trying to figure out where the money is. And it's sounding like it's
okay. So when I was 16, I tried to kill myself.
Okay.
So when I was 16, I took
fuck.
22 sleeping pills, and I drank a bottle of wine, and I tied a plastic bag over my head, and I fell asleep, and I just woke up later, and I ripped the bag off my head, and I was just alive. And what were you gonna ask?
Do you remember what you were feeling when you tried to kill yourself?
Oh no! Are you telling me he's literally just gonna play the entire interview?
He was really dumb. There's a game I was playing called Asheron's Call from when I was 10. It started dying because of World of Warcraft, and no one else was on to play anymore. And I felt like the only thing I cared about and the only thing I'd practiced my whole life and really loved was irrelevant.
Okay.
Yeah.
Great. I mean, not great, but I think I'm starting to see a pattern. Okay. And why are you finding purpose again?
My life is
What do you
irrelevant.
like about what you're doing?
Great, dude. I love to hear that.
I like that I'm trying to give people something I wanted as a kid.
Who's the focus on? Who are you thinking about?
Just people haven't experienced what I did.
Yeah.
Aww.
So I'll tell you, Reckful. Listen carefully now.
It always like
your depression
is really
you're
touching
trying
for
to
me.
cure the depression that is growing.
Having seen a bunch of those videos over the past,
you're trying to protect them from what happened to you.
The past week or so, every time I see Reckful cry, it's actually
that feels good.
Yeah,
really touching.
Feels meaningful. Yeah.
Good is an understatement. It's an understatement of the fucking year. It is vital. It is crucial. You must do this thing.
Yeah, I agree with you. Yeah.
Yeah. So I started streaming about 2.5 months ago. And, you know, was advised against doing that by a lot of people in like many of my colleagues and stuff like that, because I can get sued and all that good stuff and talk to attorneys and things like that. So hopefully I don't get sued because I'm not really delivering medical care. But, you know, what happens if someone comes on stream and then kills themselves or something like that? I mean, I think at the end
I'll try not to kill myself anytime soon for you.
Yeah, thank you. I appreciate that. I'm serious. I think
no problem. I haven't thought about killing myself since psilocybin, I think.
Yeah. I believe that. If you do happen to have those thoughts again, feel free to reach out. You have my Discord.
APA commentary on ethics and practice, the ethical and professional basis of the physician-patient relationship. The physician-patient relationship is a collaborative endeavor between two autonomous individuals who establish the professional relationship for the benefit of the patient. Every effort should be made to have the relationship begin by mutual consent. Psychiatrists should be cautious in interactions with persons who are not, or not yet, patients to avoid rendering input, advice, or other suggestions that might lead to the assumption or expectation that a treatment relationship has begun.
I believe that that kind of relationship starts off right in the beginning with what I call a contract. And a contract is establishing what we're going to do, where we're going to do it, and why we're going to do it. And to do that, it means that the individual is saying to the therapist, this is what I need, this is what I'd like to have. And the therapist says, this is what I can provide. And if that's a contract, we can go. They may want the therapist to fix the problem. They may want advice. They may want pain relief. And those are not essentially aspects of therapy. Therapy is to hold up a mirror to the client and have them see themselves and then consider options for parts of their life that they would like to change. It is the job of the therapist to be crystal clear and to have their boundaries established. And the one thing that is paramount with therapists and professionals is to do no harm. Many people come in and they are not clear on boundaries. They're not clear on maybe exactly what they need, and that needs to be worked out in the process. If you provide confusion to the client, then you are causing harm. There's a problem with using therapy skills outside of the therapeutic process, because those skills are designed to have people open up to intimate parts of themselves, things that may not have been mentioned to anyone else, including marriage partners or intimate partners. The individual that is not the therapist is often just answering and being engaging in the conversation. And they often do not realize when they have gone into a realm that is very exposed and vulnerable. And you do not want to go into those areas outside of the therapeutic process, or once again, you can do harm. It's a little bit, the medical equivalent would be to provide some kind of service, a medication, or even a procedure without the beginning and the end and the ability to follow up. And that can cause damage.
The two biggest things I can think of are, number one, it can set up a dynamic where the client feels obligated to take care of the therapist, not unlike an unwell parent obligating a child to take care of them. And I think most people can agree that.
Okay, so I understand what she's talking about. I don't remember the name in the psychology, where this like codependent for this like specific kind of codependence, where a parent makes the child take care of them, whether it's emotionally or even physically. That is really toxic. That is not what I see in what I've ever seen in the Dr.K and Reckful interviews. This is just completely fucking random. What the other therapist was saying, absolutely. Like I absolutely don't disagree with it. You have to be really careful when engaging in therapy. Well, outside of therapy, which is what Dr. K is being accused of having done. But what this lady is saying is completely irrelevant. Unless they show us a clip that shows why it's relevant, it's completely irrelevant.
A parent who obligates their kid to take care of them it's bad parenting, right? And when we blur those lines, it can set up a dynamic where the person who is seeking help is in turn helping the person who they've charged with or actually paying for to help them, and eventually it becomes an abuse of power. And kind of along those same lines, there's, for a lot of people who've experienced authority figures in their life who have abused their power, whether that's abuse or some form of putting their kid in a role that they're not ready for, it can reenact that dynamic. You have the degrees, you have the titles after your name, and you're acting in role as a therapist. And a lot of people are really confused by titles anyway. And so you're still doing therapy with that person. Just by saying you're not doing therapy doesn't mean you're not doing therapy. People are still going to listen to you. You know, people often will come to me and ask my opinion on something from a therapist point of view. And when that happens, I have to be really careful to say, I haven't to not comment on things I don't know anything about, because I could potentially be doing harm to that person or whoever. I don't know what they're going to do with that information. I'm thinking about one instance where a young woman shared some things with me while I was on an airport shuttle bus. And she kind of just opened up and spilled about a bunch of things that she was going through. And I do think as therapists, sometimes people come to us with things. My response was much more to encourage her to go seek therapy, partially to respect that boundary that we're talking about, which is in a gentle way saying, well, this isn't therapy. Kind of saying, have you looked into getting a therapist? You should, that might be something you should find somebody to work through or talk through. So it was very clear that I was not that. And part of the boundary that was set was to refer her to therapy. If I start to notice that person is having like an emotional reaction to what's being said, so they might start crying, they might start seeing like kind of almost like dissociating or escalating in any way, I would probably at that point, just gently kind of ask them about, who they have that they can talk to about it. Do you have a therapist? You might, do you have a family friend or family members that you can talk to about this sort of a thing? So there would be a redirection. Specifically, if I started to see the person become emotionally activated by it, that would indicate to me that the conversation is having some sort of an effect on their emotional and psychological being. In which case, I don't want to inadvertently cause harm by continuing to either have the conversation or ask additional questions or probing questions. So that would be where I would probably be where I would cut off.
So like I woke up one day and I said, I'm going to.
Okay, so yes, if you do what she described, that's really bad as well. Now, you can't just say it's a bad thing and then not explain why that would apply to Dr. K. I maybe the tone of the video is to like let you connect the dots, but the people watching, myself included, are not trained therapists or psychiatrists. I actually do care about a professional person, a health professional, dissecting what's going on, because my interpretation of what's going on is that it doesn't quite, I don't know. Well, I'll watch.
start talking to gamers over the internet. And my lawyer said you could get sued because someone is going to think that this is therapy and you don't have a doctor-patient relationship. And one day someone is going to kill themselves and their family's going to sue you because you were pretending to be a doctor. They said that this would be easier if you actually weren't a medical professional because you have a license and you have obligations. But if I don't do it, who is? Right?
Yeah.
Like it's Friday on November 15th, 4:23 in
4:20
in Eastern time. And like you're stuck. If I don't talk to you right now, Joro, who's going to talk to you? Like it's me. That's it. So let's say that for a moment that
That's
I'm
been a
doing therapy
weird
on Twitch.
sentence to
So there's like
say.
an ethical concern with that, right? Because like, I'm talking with people publicly. And so if I'm a doctor and we say that there's an ethical issue there, then that means that I'm not allowed to stream on Twitch, right? Does that make sense?
Yes.
So then like if someone wants to offer life advice or wants to help people on Twitch, what we're essentially saying is that the more qualified you are, the less we are going to allow you to do that.
That sucks.
Right?
Yep.
It's interesting. When you say that clinicians, licensed professionals are trained. So what we're really trained in that the average, internet guru is not is clinical illness. So if you look at like literally the, American Psychiatric Association's definition of therapy, it's like, an intervention that is designed to help someone with a clinical illness, to treat depression, schizophrenia, bipolar disorder, addictions, things like that. So I know that what I do looks and feels like therapy to some people. Probably overlaps at some, but I don't think I think the real thing that, and that's because you guys just haven't seen me do therapy. Like if you saw me do therapy, you'd understand the difference. And people who have come into my office before understand the difference. There's a longitudinal relationship. There are usually diagnoses involved. There are treatments involved. I don't treat anything. I don't diagnose anything. And some people may feel like that's a technicality, like I'm starting that, but really it's not.
I also don't think it's
I think this was to provide detail about the ethical boundaries that Dr. K is crossing. Yes, absolutely. That is why this is that clip was shown. But the problem is that there is an ambiguity. Like what Dr. K is saying right now, there is an ambiguity where me providing advice on stream, I never am going to run into the threat of a lawsuit. And providing advice to someone, well, it's terrible if it's bad advice, but you kind of have to show that it's bad advice. I don't know. So let's just watch.
possible to have a real mental health therapy session on camera. I could never open up to you on camera the same way I could open up to you as if we had a private relationship as patient and therapist.
Okay, yeah, what she just brought up is my biggest issue with what Dr. K has been doing in general. This idea of doing therapy, well, not therapy, publicly on Twitch is absolutely fucking batshit insane. I'm glad we got
Right,
this
so, like,
that.
I think some people, it's hard for them to understand that, but like anytime you put a camera on somebody, they will change.
How does a camera change? Wait, hold on. I was going to ask you a question about how a camera changes you, but it occurred to me that that is outside of the two topics that we had discussed. Are you okay if I ask you that?
Sure, yeah.
How does a camera change you?
So is the majority of what you're doing still direct one-on-one type of therapy, basically, and then using that as an example for how other people can follow it? Or are you doing more?
Yeah, so I think so. First of all, to be clear, it's not therapy, and I can't dispense medical advice over the internet.
Yeah.
But so I think what I do is just talk to people.
So-
Well, just to be clear, this is not therapy,
Sure.
right? We're just
This
chatting.
is,
This is just chatting on Twitch.
yes, this is just chatting. It's
that's-
not therapy.
I just want to. So, in a lot of ways, Sky, it seems like you've grown and you've moved past this, and you've become confident in the person that you are. Just to be clear, though, this is.
Do you think people can distinguish how much they can open up if they've never been to like a private therapy session? Maybe, maybe not. I actually think there's maybe a little bit of a pathology in, but like I'm not a psychiatrist. A little bit of a pathology in opening up too much in public. But to be fair, like on one hand, we're talking about streamers, so people who, for the most part, don't actually have much life experience. But on the other hand, we are talking about streamers, like professional streamers, who actually, if there's one thing that they do have experience in, it is in being public figures and sharing enough of themselves to appear genuine and to develop at least a minimum of parasocial dynamics and connections with their community, without making themselves too vulnerable to the point where they burn out, where they get destroyed by criticism, where they get attacked for their personal life, where they dox themselves, etc., etc. So I would assume that for those people who are capable of knowing how much they can open up, But then the problem is, and that's where I was agreeing with like what the lady was saying, you don't do therapy with someone if they're not in a context where they can actually open themselves up. Then it's just like it's on Twitch, it's just showmanship, it's entertainment, and it's not necessarily even a bad thing, because there is an argument to be made that he's taking away the stigma from that's around mental health that we all have, that still exists, and helping break it down, and that is positive. But I don't know if even when people feel helped by talking to him on stream, I would feel really uncomfortable. I would love to talk to him, but I would not walk away thinking like, wow, that was a good session. Like there are things I'm not gonna say. It would be insane. Not therapy is Dr. K's version of in Minecraft. Yeah, I agree.
It's not therapy, and you understand that, right?
Yeah.
Okay. So tell me a little bit about what you mean by depression or anxiety. So what can I help you with?
I was wondering if you knew where to go next.
Fantastic.
From my point of view. Yeah.
Okay. That I can certainly help you with. So when William tells us that he is an 8-year-old boy who is screaming at his mom to stop and banging his head against a wall, and she continues to yell at him for an hour and a half, and that shit happens day after day after day after day, that is a whole different ballgame from being like shot once or being robbed or being raped or whatever. That's complex PTSD. Okay? So now let's think about what are the treatments of complex PTSD. And if you've got a real flaming weebo who's got a relationship and wants to come on stream, because you're like halfway past all this shit already, man. It's disappointing. Like we were looking at
I hope chat doesn't feel debated yet again.
Yeah, they were debated, man. You bathe and you work out and you're making a career change and you take care of yourself.
I overheard him talking to his friend. I don't know, I was like 12. That he told his friend that he wanted to kill himself. It was weird to hear my dad say that. Yeah.
Reckful, do you have a therapist?
I've gone to therapy a few times, but I never saw it as useful enough to keep going. This time I do. Well, okay, this is not therapy. But you know what I mean. But it wasn't.
So, okay, so look, man. So this is what we got to do. So I think this is way more longitudinal. Like, so there's something. This is way more longitudinal, right? So I think we have to we got to figure something out. So either you need to talk to someone about this because you understand things that you didn't understand before, or like I can't do one-offs. Like we can do one-offs about meditation and random shit, but if you really want to get into this, if you want to get into loneliness, we got to do it like in sequence. Like we got to do it sequentially. Like we got to do it.
I'm fine with that.
We got to get started. Yeah. So let me just think about that. It doesn't have to be online. But if you want to do it online, that's fine. But then I think we have to do it consistently. And
how consistently?
I would say probably every week for like 4 to 8 weeks.
That's not that long.
I mean, it's not that long, but it's.
I'm willing to do that. If you are.
So, yeah. I mean, I'm willing to do it because I think, let me just think about it. Let's figure out how to do this. You just sleep on it and then you let me know like tomorrow or like whenever you want to let me know. Okay. So I'll message you. We'll figure it out. Let's do like maybe January 7th, 8th, 9th, 10th, like sometime in like the second week of January. Okay. And then we'll do like.
I got to survive a long time on my own. I got this.
In this clip, it's obvious Reckful isn't sure about the relationship. I don't know if I would read into Reckful's reaction, but I would 100% read into Dr. K prescribing talking regularly. Like it or not, the way Dr. K is talking, like we're gonna have to talk like this often, etc., etc. That is what a therapist would say. Like a friend could say something similar, but they wouldn't say it the same way. People who seek therapy aren't always completely rational or aware what could cause them harm. Yeah, that's fair. I think this is a case of the patient can't consent to waive their rights and have pseudo-therapy. Also why ethics rules are so strict. Yeah, that's fair. The only thing where I do see some nuance is that technically at some point when a friend has problems and comes to talk to me, what I will do with them is technically therapy. But there is none of the responsibility around therapist training. There's none of the medical. I haven't taken a Hippocratic oath. I haven't taken the training either to wield therapeutic techniques and psychological techniques. So maybe that's what makes it okay. According to the lady who talked earlier in the video, that's kind of what makes it okay, right? She talked about techniques and the fact that wielding them outside of the very regulated space of therapy is unethical in and of itself. Maybe that's the argument here. I'm still thinking about it. This is what Dr. K said. The people we allow to do these things are the ones who are unqualified. Yeah, and like there is something to that argument. I don't want to throw it out just off the bat. But there is also something to the ladies' argument where a therapist has techniques that a normal person is not going to have. When Dr. K said asked about his experience with therapy, Reckful said, "Well, I like it this time. That's what made me think he's unsure." Oh, was that what he just said? Sorry, I missed that. Yeah. The Reckful. Okay, yeah, that's fair. That's fair. And now that you say it, I saw in some other videos excerpts from their discussions where Reckful was saying similar things, where it was clear the boundary itself was not clear in this whole shenanigan.
Yeah, I mean, you can message, like, I can talk to you in between that. I just won't be streaming.
Yeah, I got it.
Okay. You can just message me, dude. Just message me. Okay. All right. Strong word, Reckful.
All right.
Okay.
Yeah, thanks.
This reminds me, I wanted to share with you because I thought of this. My dad wrote a book. He actually wrote several. But in the book, he had a fictional character who was based on himself. Had a different profession, but the same backstory with my brother who, his kid who committed suicide. And then he wrote the actual experience of what it felt like for him when my brother committed suicide. And I wanted to read it to you.
Sure.
Thought maybe. Yeah.
Please.
And when I was 16, I actually edited the book for my dad. So I read it all the way through back then. Because he didn't get an editor. I wasn't very good at editing. I can actually do it much better now. While I'm reading it, I would want to change some words around. Anyway.
Just read it.
My son had been suffering from a severe depression for several months, and I did sometimes fear the worst. So when my wife called me at work on that evening and said that his room was locked and he wouldn't respond to calling his name and knocking on the door, death immediately reared in my mind, and my heart palpitated with a pang. I shouted, "My son is dead," and I started sobbing savagely and uncontrollably. My secretary drove me home. Someone climbed to the rear window of his room and broke it, then immediately screamed to call the paramedics. Leora, her name's really Judy. Judy ran to Guy's room, the secretary following on the steps. Judy came out of the room crying hysterically, her pain throbbing around me. The paramedics came, and she re-entered the room with them, but they could only confirm Guy's death. My own darkness engulfed, sucked, and suffocated me. Inescapable misery constantly bashing my heart, gashing wounds of unbearable pain. Memories of my son melted my brain like butter in boiling vapor, driving me insane. And the worst was the absolute impossibility to run away, and to vanish and disappear. There was nowhere to hide, except that blessed sleep came to me some nights after many hours of twisting in my bed.
So what I get from you is a profound sense of sadness and loss. The thing that I don't understand is how much of that loss is for you, how much of that loss is for him, and how much of that loss is for your dad.
Okay, yeah, not doing this today. Yeah, this is going to be this is going to be a rough watch. This is not going to be fun. Definitely got to warn you. It'll be fun after this video. Once we're done with this, we're gonna go back to some more fun content. But this is not going to be easy to watch.
I feel bad for my dad for sure. But I don't know.
So, Reckful, I have a crazy ass non sequitur question for you. Okay?
Yeah, sure.
Do you want to have children one day?
I always thought no, because I'm scared they'd kill themselves.
Yeah.
Editing something like that.
Informed consent. Psychiatrists should recognize the importance of informed consent for assessment or treatment as an essential means to recognition of and respect for the patient's autonomy and personhood.
Informed consent is a complicated process that, once again, we have to rely on professionals to understand. When a situation is blurry, it by itself makes sure that the client is not crystal clear, and they don't know where the process and the conversation or the relationship is going. And so how can they agree to something where they don't know what is happening and what's going on? So the therapist needs to be the one that says, here's where we're going to go, this is how we're going to go, and this is what we're going to do. Is that okay with you? And if so, I need your informed consent. Informed is a very important part of consent, that they clearly understand the process. Otherwise, once again, we're back to, you may be doing harm. It is a tendency for all professionals to, for example, take a celebrity or take a politician and want to use diagnostic terms. But that is unethical, and you should never use diagnostic labels with people that is outside of the therapy process. A professional needs to understand that if a individual hears someone that they respect as a professional and identify them as a professional, and they start using diagnostic terms or even characteristics or criteria, then that is going to stick with the person, and it could, again, cause damage, and without any ability to follow up on that. I think it's the job, once again, of the professional to avoid that conversation entirely, because a client could say, or an individual could say, I wonder what he even thought about that issue. Gee, bipolar or narcissistic or characterological disorder. I mean, why did that even come up in his mind? Gee, I might have some kind of symptoms of that. So it is our job to avoid that entirely.
It's good to make a video about this and why these rules are in place. I think it would also be important to say that there are some exceptions to these things, because I don't want people to get their takeaway to be that, well, these rules really are rigid, because they're not. And even things like certain dual relationships may not be rigid. And the point here with Dr. K that I think you would want to make is not that just that the rules weren't followed rigidly, it's that these weren't tolerable exceptions. That these aren't just dual relationships, but these are dual relationships that are not in the best interest of the patient. For doing 6 sessions on stream plus whatever amount off stream, if you're gonna after all of that not be clear what your doctor-patient relationship is, that's pretty murky. By episode 6, it's being called therapy in quotation marks. You want to have it clear before that. You're at the point where you think someone might have a psychiatric condition that needs care or needs treatment. There's a fork in the road. You either are going to go all in and say, okay, look, I'm your therapist, I am your psychiatrist, you are my patient, and we're going to establish a doctor-patient relationship, and we're going to treat your conditions or work you up for what you have. Or you refer the patient to someone who will do that. You don't want to delay care by continuously evaluating whether you're going to be friends or streamers, doctor-patient. If you think the patient has something that needs attention, make the decision and go with it.
A blurry relationship, every interaction, well, I would imagine that every interaction, the person wouldn't be able to tell if is this a conversation with a friend or is it a conversation with a therapist? So if you think about informed consent is I am agreeing to treatment. I'm agreeing that we're going to be talking about things. I'm allowing you to intervene on me in whatever modality that therapist has. If you have blurry lines and the patient doesn't know when you are doing things to them, right? So they don't know, is this just kind of anecdotal information? Is this just this person being my friend, or are they actually kind of operating on me? And in that regard, if you have a blurry relationship, the person can't actually know kind of what's what. If
I feel like people absolutely take it as a conversation with a professional or therapist, especially since he's in the field. Yeah, but I mean, the thing is, okay, so let's try to put it in an IRL perspective. Okay, so first off, a disclaimer: the psychiatrists that I've known IRL were all weirdos, so maybe not good examples, or maybe good examples. I don't know. But I'm trying to think. Like, obviously, if you have a relationship that comes from a normal perspective. Can confirm my mom is weird. Yeah, it's kind of a stereotype, but it's one that checks out. It's that usually the people who are interested in psychology are the people who want to cure something within themselves first of all, which means they have something that they're trying to deal with. Anyways, enough armchair psychology from a non-therapist. What I was gonna say. So, like, from one perspective, if you're in a therapy session and your therapist is feels like the relationship is blurred, whether it's romantically or platonically, it is their responsibility to tell you that they can no longer treat you and that you must they'll either recommend you or just direct you to find another therapist. Or psychiatrist. You cannot ethically continue treating someone if the relationship becomes blurred. Now, keep in mind why here there's a big plausible deniability is that the relationship allegedly didn't start off as therapy. The relationship started off as two Twitch streamers having a discussion on Twitch of not therapy, and that's where the whole debate is about. It's not clear cut, but but I'm saying that because it's not just that people take it as a conversation with a professional therapist because he's in the field. People take it that way because there actually were very ambiguous interactions between the two. So, yeah.
If you're acting in the role, not in the role of in the therapist-patient relationship, you can't diagnose somebody because you're not acting in an impartial, unbiased manner towards them. So if I take somebody on as a patient, I take their history, I take a history, I might do some psychological evaluations to differentiate between different diagnoses that are going on. If they're not my patient, I can't do any of that.
I mean, I don't know. You can call something not therapy as much as you want. If you're doing therapeutic actions, then it's going to be therapy. No, that's the argument of this video at this point. Yeah, that what Dr. K was doing was therapeutic actions, and that thus they should be judged as if he was doing therapy on Twitch. And honestly, there's a lot of it. It's a strong argument. It's a very, very strong it's my biggest issue with what he's doing is he basically is doing therapy in public. It's a very strange thing to do. I don't think there's any debate because he literally calls himself Dr. K. If he didn't use that title in everyday conversation on Twitch, then he wouldn't be acting in that capacity. Pretty clear cut here, Imo. That is absolutely fair, yeah. I would say, though, that the idea that they could have just referred Byron to a new therapist is somewhat naive. He started out saying that he thought it was pretty useless, etc. Maybe he could have gotten him to see someone else at some point, but you see what I mean, right? Absolutely. I understand what you mean. But still, the consensus in those discussions, my understanding of it is that if the relationship is blurred, it's better not to have the relationship, rather than be held hostage to some idea that you're keeping the relationship up is the lesser evil. And maybe that argument is a pure liability argument, and it's not actually what's best for the other party. And maybe you can argue that, but my understanding is almost all therapists will agree what this lady is saying, and they'll agree that the relationship there was wrong. We haven't gotten to the 2-year friend thing yet, right? No, we haven't.
Another piece to it is that when we diagnose somebody, I mean, having the degrees, whether it's a psychiatrist or a licensed mental health person, diagnosing somebody carries a lot of weight to it, right? So insurance companies base a lot on diagnoses. There's certain diagnoses that are very stigmatizing for people. To just go around diagnosing people that aren't your client is potentially extraordinarily harmful to those people.
I'm going to talk to you about something called borderline personality disorder. I don't think you have this, by the way, and it's not
really
a place to diagnose
okay.
it.
A lot of people think I do have that.
Maybe you do. I don't know. So I don't have enough diagnosis.
I don't know.
Showdown.
So I'm going to just talk a little bit about borderline personality disorder because I think that there's some features of it which are relevant.
Yeah.
And also like some very interesting data that some people don't know. So the first is that borderline personality disorder, a lot of times these people have a fear of abandonment. Okay. And so they do get overly clingy. And as they get overly clingy, they sort of like force people away. And then it kind of like reinforces their fear that like they're unlovable. Yeah. And then that sort of, and each round makes it worse because once you do it to the first person, your sense of being unlovable increases. And then when you interact with the next human being, like that wolf has become hungrier. And so when they sort of treat you well, they feel really good about themselves. And when the person starts to like kind of slip away, it gets like stronger and stronger and stronger. And each round is like becomes, as you put it, a self-fulfilling prophecy and makes it harder. Mm-hmm. Now, what many people don't know about BPD is that BPD, there's actually some very interesting data. So a lot of people think of BPD as being incurable. But there's some really fascinating data that if you can get in a stable relationship for 2 years and have someone not abandon you, then there's a 50% chance your BPD will like actually go away. So it's really fascinating. And I think
it's the opposite of you shouldn't get in a relationship until you're stable on your own.
Yeah, and I think that's what you need. You need someone in your life who's not going to turn away for a period of at least 2 years, and you may be terrified that they'll turn away.
Sure, but then I think you kind of have to be able to say that, yes, that relationship shouldn't have happened, even if it means Byron continues to have absolutely no interest in seeing a professional or seeking help. Well, you can also argue, if you're going to make a prescriptive statement, you can also argue that Dr. K should have been a lot more careful in how he approached relationships. Dr. K himself, I don't remember what interaction exactly it was, but Dr. K himself, after it wasn't one of the videos we watched on Friday a couple days ago. Dr. K himself was talking, reacted to something he said to Byron. And he was like, wait, I shouldn't have said that. I got emotional. I reacted to your emotions. Like, obviously, a psychiatrist, a therapist is still a human being. And it's, of course, they have their own emotions. But those kinds of things happening should be ringing alarm bells in their head of like, what? Okay, I need to be really careful with what's going on in the relationship. And what those people are trying to show in those like hit piece videos is that they don't believe that he was being careful, right? And they believe he was being negligent.
Away at 2.5.
Right. I might never get it. I mean, there's no guarantee I will, but I'll look for it. Yeah.
Yeah. So sure, there is.
I wouldn't
Fuck,
say
die
so.
here.
There's only one
I've
way.
gotten in some really unhealthy situations because I'm so desperate for human interaction that I'll have, paid people's rent just so they'd be my roommates. So I'd have someone around, done it a few times. Just a lot of dumb things like that, or try to get them to quit their jobs and like give them a new job that requires less time so I could have a friend. And then obviously I've realized that these things are unhealthy, but I was just in desperate situations where I needed human interaction.
So Reckful, I'm confident I'm confident that there's going to be someone around in your life who will be there for you most of the time when you need them, hopefully, for at least a period of 2 years.
Okay.
How can I be confident in that?
How can you be confident?
Yeah.
Well, you find me stimulating to talk to, and I'm not demanding too much of your time or spamming you with walls of text. And even if I were, you'd feel inclined to answer me because it's
Right, I'm not dead yet.
you love helping people. it's your passion. So from your perspective, maybe you can feel confident, but then if you put yourself in the shoes of any other human being, I don't know that they'll really spend 2 years with me unless there's.
So Reckful, I'm not counting on them.
What about Mr. Girl? Does he have new info? I don't know. This is the Mr. Girl video, and Mr. Girl only has intervened for like 10 seconds to read some APA directives. Mr. Girl allegedly had interviews with people who've worked with Dr. K, and that's supposed to be new info, but we haven't seen it yet. We're not that far into the video, so.
I spent 2 years with you.
What are you counting on?
I'm counting on myself.
Oh, you'll spend 2 years with me. Yeah, that I believe. That I can believe.
There you go, the 2 years.
So I can't trust any of them.
True.
So I'm going to try
It's nice
to love
having
you
someone to come to every week like this.
I'm going to try to love you for 2 years at a minimum.
I really appreciate it.
So this is the other thing is that I do helping people, but I also like helping you. And I want you to understand this. I'm not even helping you. Like, this isn't help. I don't like the phrase help. Help implies like charity, right? It implies that you have something and that you have nothing and I have something and I'm like helping you. I'm not helping you. This is just me being human and you being human. I don't know if that makes any sense. I think it's one of the hardest concepts.
What do you mean by human?
It's just like, we're just being us, man. It's not something fancy.
You're doing what you enjoy.
It's not about enjoy. It's I'm being who I am and you are being who you are. And that's the most that we can expect of ourselves.
I want to update the viewers on what happened off stream because they missed one therapy session. That isn't therapy.
It's not therapy, right? So that's actually what we talked about, right? So I think my impression was we were talking about clarifying what our relationship is and whether this is therapy or this isn't therapy and what our options are in terms of how to form a relationship. And I think that, the last time we talked on stream, we had a conversation about abandonment. And then I made a very bold claim because I got emotional as well. And I felt like I wanted to be there for you so that you no longer felt this way. And I think sometimes what happens amongst people is that they have different kinds of complexes, and I have them too. And one of the things that happens with me is when I see someone hurting, I want to make them better. And sometimes I will, in that moment, say whatever I think I can to make them feel better, but sometimes that's irresponsible. And I think in a sense it was irresponsible, but
Can we clarify what our relationship is? Okay, so this is exactly what I was talking about. Dr. K himself, after that 2 years thing, recognized it was a mistake. And here he's admitting it. And he's trying to walk it back.
From our perspective, we're trying to understand, like, what is this for you? What is this for me? What are we doing on Twitch? This is like kind of a new thing. And I think a common perception is that if you're talking about feelings with someone, then that is therapy. But I think we can kind of say, like, so Reckful also shared with me that he had a great conversation for several hours with Pokimane. Am I saying that right now? Right, where he also talked about feelings and things like that. But I don't think that I don't think that Pokimane is your therapist. I don't think I'm your therapist. I think you can talk to another human being about feelings and you can explore things that are authentic and important to yourself, and that doesn't necessarily make you a therapist. And so we were also talking about the other options in terms of like, what are we? Are we like colleagues, like that stream on Twitch together? We'd sort of talked a little bit about, you know, things like viewership and stuff like that. I raised some concerns about favoritism. So I want to try to treat people equally. And I just wanted to kind of acknowledge that if one person is coming on stream over and over again, are we doing a disservice to other people?
Which I think you are. So I think I shouldn't come on stream over and over again with you every week.
Yeah. So I think, and so I think that too, for me, feels like it's closer to a doctor-patient relationship, which I think becomes really complicated if you're kind of working with someone week after week, you know? And I think the other thing that we expressed is that, like, so I want to be Reckful's friend, right? So, but if I'm your friend, then can I be your doctor? Do I want to be your doctor? Do I want to be your friend? And I think the reason that this kind of relates to Reckful is because I think Reckful I think he's a very warm, open, and caring person, and also tangles up his relationships with people. And it's something that I actually do too. So I tend to tangle up relationships with people. I tend to not see things in terms of black and white. And that's the reason I started. Sure. That's part of the reason I started streaming anyway, because like no one talks about feeling, like, you know, no therapist or psychiatrist has come live on stream to like talk to people about mental health or their feelings. Or maybe it does happen and I just haven't heard of it. But I think that's a little bit unorthodox.
Yes,
I said my piece.
He was saying that he wanted to be there for me for the next 2 years, and that but the problem is that he kind of said it in a flurry of emotion. I don't know if flurry is a good word. While streaming, he was getting emotional himself. He wanted to be there for me, so he said it, but he hadn't actually thought it through and what that entails, because he is not a licensed therapist in Texas, and just a lot of things, you know, because you'd have to live in Texas to be my therapist in Texas. Is that how it works? Yeah.
So we also did talk about, you know, whether you want me to be your actual therapist and what that would entail. And the other thing is that bit of research, which is important to remember, is that the research on people on BPD, it's 2 years of someone who's actually a romantic partner. So it's unclear whether a friend.
So yeah, I need to get in a relationship with a girl for 2 years and have it actually work out, and that might cure my BPD.
Yeah, and so this is what we also kind of talked about. I don't know if you remember, but like, you know, it's not about curing and the relationship working out. It's about developing.
I have trouble not thinking in these terms. Yeah. Okay.
Yeah. So exactly. So that's what we need to change, right? So you think about things in terms of working out or not working out. I think we had talked about. So what's going to happen as you enter relationships is that there are going to be stressful parts and not stressful parts. And if there's a stressful part where your some scar of abandonment gets triggered, then you may act in a different kind of way. And we can talk about that. Like, I'm curious about, you know, your prior relationships and things like that. And as that some scar activates, it causes you to do things that you normally wouldn't do. And those are kind of driven by that fear of abandonment.
Unprocessed trauma.
Unprocessed trauma. Great way to put it. Right? So
you will be hurt every time someone abandons you, but I can't fix that. I won't abandon you. Next session. Sorry that I was a lot. I can't promise not to abandon you. I don't think I could find a more irresponsible way to do this if I tried. No. And yes, it was irresponsible to... Okay, so it was irresponsible to say that in the first place. That was a really bad thing. And a trained therapist should not make those kinds of mistakes. They really should not. You literally train to not do those kinds of weird emotional things that we all do to each other. That is what sets apart psychiatrists and therapists from just talking to a friend. They want to do like weird emotional things. But him acknowledging it the next session and admitting to his mistake and walking it back is as responsible as he could have done once the harm was done. He had to. He had to say what he said there. I don't think you can find fault in that part. Outlaw emotions. Well, look, the best comparison I can give. People usually think empathy is a positive thing, right? Empathy is always prescribed as positive in society. The more empathetic you are, the less of a psychopath you are, blah, 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 blah. But then think about it. You go see your doctor and you're in pain. You're suffering. Do you want the empathy the doctor is feeling, the compassion they're feeling with your pain, to cloud their judgment? No, you don't. You want them to be able to look at your situation neutrally and be able to diagnose you correctly. Obviously, you don't want them to be completely apathetic, but you need to. There is such a thing as too much empathy when you're talking about, especially when you're talking about healthcare. And there's such a thing that's not enough empathy in healthcare too. But in psychiatry, in psychology, it's very specific. Dr.K just went live. Drama ignore. Should we do that? Isn't that like a Twitch TOS thing though? Like restreaming someone else's stream? Oh shit. He went to Tufts. He did his residency at a place affiliated with Harvard. Okay, his streams is starting soon. I'll just keep it open on the side. If you're gonna watch his full stuff, I think that wouldn't be good. Yeah. Yes, but nobody cares. That
Some
sounds
of the trauma
good,
of losing
yeah.
your brother, one brother and then another brother. Like you're terrified that like you'll lose someone else, and so you try to.
My other brother's still alive. He just means he's not around.
Yeah. And so I think what we need to help you do is like use meditation or psilocybin or however you want to, but to gain perspective on those moments and essentially ride out those emotions so that you can like not do something that negatively impacts the relationship. So we need to help.
My mind is stuck on certain things right now.
Yeah, tell me.
So I'm stuck on. I like to get these things solved, I guess. I don't like to be in the tension so much.
Beautiful.
Yeah, so I'm in the tension of, is he going to be my therapist or are we going to be friends? Because he said if he's my therapist, we can never travel together anywhere. Like, it changes how it is. So I was thinking it'd be cool to go to Japan with Dr. K. You know, that sounds nice. Yeah, that'd feel nice.
Yeah.
Just see how he experiences things and have fun. I don't know.
Yeah, so I think it's
actually
good.
I really want a friend, but you know, then I'm thinking longer term. I'll have friends. So what I need is a therapist, maybe.
Yeah, so I think rather than resolve that issue, Reckful, I think the important thing is that you said something really, really beautiful, right? Which is that you do not like the tension.
It's a big problem in my life, yeah. I
That's
don't like the tension. Every time I'm around a girl, I like to just have it resolved right away that, okay, this is not going to be anything romantic for sure, or it might. Like, I just want to get it out of the way.
Is it okay if we talk about that?
Confidentiality. Medical confidentiality is the physician's obligation to his or her patient, not to reveal the patient's personal or health information without that patient's explicit, informed permission.
First of all, waiving confidentiality is called privilege, and the individual can waive confidentiality in certain situations. It is the responsibility of the therapist to make sure, back to something like informed consent, that they are waiving that privilege, waiving that confidentiality in an appropriate way that will not come back to harm them. An example of that is in my setting when I work with children. The children often want their name in the paper. They want their picture in the on the evening news, and of course they're not in a position to be able to make that decision. There are some adult clients that will waive confidentiality, but the therapist should know that that is not going to be in their best interest.
People with, I would say, high risk patients, so people who either have attempted suicide in the past or have a history of suicide in their family, which makes them at a higher risk of suicide. I would say people who have a trauma history, sexual abuse survivors, physical abuse survivors, because the nature of, in those, particularly sexual abuse, the nature of sexual abuse is exploitative, right? And so then you're reenacting that trauma, right? And when you put them into a situation where people are watching them. And I mean, essentially, we don't know what all the viewers are doing with that information. So you're setting them up to be exploited, let alone whatever gain the therapist is getting out of doing that, which is considered to be exploitative also. What happens after the therapy session? What happens if that person who is at high risk for suicide regrets what they said and there isn't a therapist around to support them anymore? That is absolutely a setup for them to engage in some sort of self-harm or potentially even attempt suicide.
I think I'm okay with like explaining scenarios and like circumstances and how I feel and stuff, but I don't want to like name people.
Okay.
That's the only thing.
Okay. I completely understand and respect that.
Yeah.
But I want to I think it's important, if it's okay with you, for us to also talk about what makes you uncomfortable naming people. Not that you have to name the people, but can we explore the feeling of hesitation about naming people?
Yeah.
Okay. I wonder if it's actually fear that's keeping your mouth shut. I'm beginning to realize it's not fear. I think what you're trying to do is preserve and protect. What do you think?
Yeah, I agree.
There's Yvonne. Support player. Protecting. Taking it for the team. And boy, did you take it this time. Who are you protecting? I'm not asking you to name those people. I mean, in general, like, just to be clear.
I was like in my room, in my bed, and then he came in and he...
Do you guys live together?
No.
Okay.
Yeah.
How does he get into your house?
Now
I think we've got to talk about like why. I'm not trying to pressure you into speaking or anything like that, so please understand that. But I do think it's important, very important, for people to understand why you can talk about the general, and you yourself, why you can talk about the generalities of the situation without naming names. And once again, you get to pull the plug at any point, Yvonne.
Okay.
And I may pull the plug if I think, I'm going to try to pull the plug for you if I think that you go into a catatonic space and you can't pull the plug yourself. Okay. So what is it that makes it hard for you to name names? how do we understand this more without compromising what your goals are, which I want to respect at all costs? Because the question that I want to ask is like, who do you love that you're trying to protect? But I think that that's the question that you don't want to answer. So I can't ask that question. But I feel like that's the important question. You with me?
Mm-hmm.
Do you think they want you to make that sacrifice? Do you think they would want you to be silent? Okay, so I think if you want to stay silent, then I think maybe we've done enough for today. What do you think?
Yeah.
Does that sound good to you? Okay. Mm-hmm. So one last question.
Mm-hmm.
And then I should teach you meditation, but boy, is it hard to teach meditation after this.
Yeah.
So do you feel, so I know that you don't want to name names, fine. Do you feel comfortable saying who it is that you love and for whom you are choosing to stay silent? Or is that too much? Because I don't know if that's the same people.
Oh,
right.
Just think in general, there's like not a lot I want to say in regards to that.
Okay.
I can't ask about it. Keeps drilling.
In cases where you are not paying.
Yeah, like those interactions are. I know also there's like different kinds of therapy and whatnot. Like this is not the kind of therapy I would like, whereas the guy's fucking drilling me. This is super fucked. Obviously pressuring her to name names. Yeah, which, like, maybe in a certain context of therapy that would be fine. Like I'm thinking catch you guys. Like I'm thinking if it's like I don't think I would enjoy that kind of therapy. I would rather want to be in control of how the session is going, but I could see some people needing the therapist to be in control. I could understand that, even if that's not how I would want it to be. Remember, he's a psychiatrist, right? He's not doing this without knowing what's right or wrong, even if he's influenced by the spotlight and the heat of the moment. Well, it's not that he knows or doesn't know what's right or wrong. Is that whether or not he realized it, or and I don't think he's being malicious. I think it's very likely he in the heat of the moment he isn't realizing what he's doing. But yeah, you can absolutely say, like, if anyone should know better, that's him. I'm putting allegations out like that and putting that on someone is problematic from a legal perspective. Well, that too, yeah. Here's what Twitch's stance on this is. Twitch is not going to do anything. Twitch doesn't, like, Twitch has been really hands off in the past the past year. This isn't something Twitch wants to be responsible for. If for no other reason, put yourself in Twitch's shoes. Once you start taking care of a problem, it's like when you repair someone's computer. If you repair someone's computer and the next day you like replace their RAM, and a week later their hard drive breaks down, they're gonna blame you. You're now responsible for the health of that computer for like a year. Twitch doesn't want to be responsible for people going on stream and doing therapy. That is so fucking out of bounds compared for like a site that's just hosting contents. They do not want to be responsible for that shit. That it would be insane for them to do that. It's a healthy thing Twitch is doing, the smart business choice. Never change a running system. If it ain't broke, don't fix it. Yeah. And don't take on more responsibility than you have to. This is so true. This is why I try to get someone to repair my computer. For around the office, you got a big hard disk drive. Hey.
A fee to receive the therapy. That could be in a lot of different settings, but in general, we would call that pro bono work. There's also that in the legal system and in another context as well. And when there isn't an exchange of money, sometimes the therapist is a little looser. And I think that is a concern that comes up. Generally, there are set requirements for a therapeutic process, and one of those is to have a fair exchange and cost to it, so that's above board and everybody agrees. If that is not the case, some therapist might think, well, then it'll be okay for me to have some kind of gain in some other context, and then it becomes a very slippery slope. A therapy relationship needs to be focused on the needs of the client, and if the the situation switches to the needs of the therapist, you are stepping into unethical areas. And that is very concerning with things like promotional issues, being a part of advertising. That can go in many, many directions. And that's another slippery slope.
Unless there's extenuating circumstance.
So I do actually take issue with this old school idea in therapy, that therapy, if there's no money being passed around, is dangerous or is going to be harmful or is not going to be real therapy. I think when Freud theorized that, it was just a bunch of post hoc reasoning, so he could take a bunch of money from really rich people who did need therapy, probably for the most part. But like, there's a weird. I'm not saying it's bad to like be paid for what you're doing. I'm just saying there's usually when people get paid for services, they don't make up a bunch of like pseudo rationalizations to explain to you that if you weren't paying them, then you would actually be hurting yourself. They just tell you, I need money to live too, and that's fine. There's nothing wrong with that. Just don't make up a bunch of bullshit about it. That one really makes me feel weird.
Such as like low income or in small communities or some indigenous native populations, First Nation populations, it would be okay. But generally, no, because there's a high risk for some sort of social or psychological harm that could happen. Generally speaking, it's not, if the person can afford therapy, it's not a good idea to barter. In fact, it's generally considered unethical if the person can otherwise afford therapy.
There's certainly components that
if the person can afford therapy. Okay, that's a bit of a more nuanced take that I could, like, I'm okay with. Yeah, if you can't afford it, sure. Curious what Twitch's stance on this is. I just Twitch is not going to do anything. That would be stupid. Unless Dr.K gets barred from practicing and like has actual legal repercussions, then maybe Twitch will just like ban him. Maybe. Even that's not sure. I don't know. They have done some crazy stuff in the past under the harmful conduct, and you say they have to be consistent then, like repairing the computer, but Twitch will repair the PC, and the next time Twitch also might say just fuck off. Yes, but they've never. No. What I said when I was comparing Twitch to like a computer repair person, Twitch have banned stuff under the harmful conduct guidelines. But what they have put under harmful conduct guidelines was absolutely different from any like online therapy. Online therapy is something they haven't touched at all until now. And yeah, Dr. K is actually
didn't really do it in a vacuum, and I think this is something that a lot of people lose sight of. So we regularly consult with industry, other practitioners, professional associations, both nationally and internationally, about the work that we're doing. And I think the key thing is that...
Is he talking about the criticism?
I think the reason we started doing this work is because at the end of the day, I've always believed that mental health is more than treating clinical illness. And if you look at like parts of society, we have doctors who can do gastric bypass surgery, and we have nutritionists and personal trainers that can help you exercise and sort of take care of your health. And so I think what we've really sort of found at Healthy Gamer, and a big part of my own journey, has been sort of understanding that mental health is a continuum that includes sometimes medical stuff. But actually what I think is really missing society-wide is like the way that we support our mental health.
And this has been kind of our North Star from the beginning. And I think it's also what makes the AOE approach so great, because, mental health doesn't just have to be sad. It can be social, it can be interactive, fun, and sometimes it's super hype.
Meme-ish.
So for us, it's always been more than medicating a mental illness. It's about creating this mental wellness ecosystem. And so this subclinical space is where we have chosen to dedicate ourselves. And one thing, I just want to emphasize really quickly is that nothing about the past few weeks really changes our commitment to people's privacy. Especially, I know there's a lot of conversation about Ruckful right now, but we're still committed to keeping his private life private. And we're really starting to find the speculation around it to be pretty distasteful. And frankly, just because the internet likes to drama farm doesn't mean we're willing to engage in it.
Yeah, I mean, I think this is also something that we want to emphasize is that we do a lot more than what happens on stream, right? So we have a content creator program that is a collaboration with Twitch, and we really value the content creators' privacy. And so, you know, just to give you all a simple example, like if my brother or if anyone, let's say, you know, asks me for a referral, right? So if someone like asks me, like, even though I have a personal relationship with them, if they ask me for a referral, let's say they've got like a really, you know, nasty ingrown hair, or they have trouble with erectile dysfunction or whatever, we may sometimes make referrals for creators, and just because we're making those referrals doesn't mean that we're going to advertise that, right? So if creators reach out to us and need mental health support, if it's not clinical in nature, then our creator coaching program may be appropriate. But even in the event that we do refer people out, that's not something that we feel is okay to like share with people, right? If someone comes to me and is like, hey, I have this kind of problem, even though I have no doctor-patient relationship with that person, I'm not going to like advertise that, right? If a friend of mine comes to me, I'm not going to post about it in chat. I think that's just...
Oh shit, that's actually a really fair point, by the way. That's a really fucking fair point. Like to everyone complaining, saying Dr.K should have referred Reckful or anyone else to an actual medical professional for private sessions. That's a very fair point. What if they did? What if Dr.K did refer them and just kept it secret because it's none of our business? That's actually a really, really fair point. Video out in 1 to 2 hours. I actually enjoyed watching the ladies Dr.K video the second time. Okay.
No question about it. There are certain components that are questionable in the dual relationship nature that Dr.K may have benefited from. So increasing in viewers, getting a whole bunch of hits, getting a whole bunch of donations. I even remember in some of the episodes that someone donated him 100 subs or something. That there seems to be a type of business-esque relationship that's a dual relationship there, where, okay, well, yes, we're engaging in therapy. It's pro bono, quote unquote, therapy.
It should have been a given. You know, yeah, but I'm saying people are judging the situation as if they know all the whether it was done or not.
Certain conflicts,
which we don't.
There is,
to be fair, we don't.
There's
know
money that's being
that there was
based
or
on
wasn't.
You know, how many views there are. How many views there are is determined by, you know, how entertaining the therapy session is. This person, are we making headway? Are we making breakthroughs? Is the person crying? Are they breaking down? Those are the kind of aspects that are going to financially, you know, have a financial conflict of interest. Because what if making an entertaining therapy session is not in the best interest of the patient at that point in time? What if having them break down and cry or prodding may not be? Well, you know, it's in the best interest of the patient, but it might not be as entertaining. Does that mean that Dr.K did it because he wanted the views? No, not necessarily. No, of course, I don't think that. In fact, I don't even believe that. But the point is that that's a conflict that is there, and you want systems that prevent those conflicts from being there, even if you're not acting upon them.
So I think your wife reached out to me saying, "Hey, you guys have free private sessions." Because I think people from your side, like not your wife, but like people on your team have sent me like 10 emails. I can show you the Twitter DMs. Not sure if you saw, but it's just like 10 requests for me to come on the show.
I really enjoyed talking to you, and you know, if you want to talk more practically, if you ever want to talk again, just, you know, let us know.
Dr. K, I messaged him that day and I asked him, hey, I'm going through a lot of things. I really appreciate your perspective. I'll pay. Could you let me know when you're free? And he said, like, I was like 10 a.m., 11 a.m. And he said, like, yeah, no, totally. Like, are you free today at 2 p.m.? And I'm like, yes, that's in 3 hours. So he actually talked to me that day. And he's like, you don't need to pay. This entire situation is about people taking advantage of others. And when you're like this, how could I accept payment from you? You know what I mean? Like, it's the same shit. And he said that I won't accept money, but yeah, in the future I'll take your money. But like, for now, no. Like, he said he wanted to talk to me human to human.
Turns out that Lily Pichu awesomely gave us like $3,000. So she has single-handedly like funded, you know, just a gigantic amount of stuff and has gotten our first few milestones met. So a huge thank you to Lily. Yeah, and good luck. And you know, if you want to, I'm sorry, I didn't have the mana. I'm out of mana at this point. I didn't have the mana to really have that. Yeah, to have that second conversation. But if you want to, you know, I'd love to hear more details about jaded streamer resentment, defensiveness, and so if you want to talk down the road. Yeah.
Yes, I totally know what you mean. I had this problem, and I had to talk to my therapist about it a lot. Actually, my therapist is Dr. K.
If there is a concern about the client's well-being, ethically, you are bound to, in some way, get a hold of the authorities or take any steps that you can take for the best interest of the client.
Well, you need to assess them. You need to assess them for basically do a suicide assessment where you look at intent, plan, means, history, And if you determine that they're an imminent threat to themselves, you basically initiate getting them to a hospital or getting them into some sort of protective custody. So that might look like encouraging them to, voluntarily go to the ER or go to a behavioral health unit.
Oh, fuck.
If they're unwilling to do that, and you believe that they're of imminent risk to themselves, I would basically say either you go voluntarily, or I would probably call 911 or call the police or an ambulance to get them to a hospital, to assess them, to get them to a hospital.
Well, I could kill myself, and I've thought about it so many days, so many times.
So
I already had a plan on how I was gonna do it.
Okay, are your providers aware of that?
No.
Okay, can we talk for a second about that?
Mm-hmm.
What keeps you from sharing that with them?
I haven't really seen my psychiatrist since like 2017.
Okay, so maybe give them a call and kind of let them know what you're going through. Because I know as a psychiatrist, one of the things, the most difficult thing about my job is when I'm there to help someone and they don't let me know that they need help. And so if you're going through this stuff, I would strongly recommend that you reach out to your psychiatrist and kind of let them know that something is going on. It doesn't necessarily mean that they're going to change your medication or anything like that.
I mean, I'm not going to be able to do it because my friends literally, like, they chase me around everywhere.
What do you
like,
mean?
my friends don't let me be alone because they know.
No, you're talking about you're not going to be able to kill yourself?
Yeah.
Okay, well, I'm not
left alone ever.
Okay, so Natalia, that's reassuring. And also, whether you're left alone or not, I think is actually like besides the point, because the point here is that you're suffering, and there may be things that people can do for you or that you can do for yourself to suffer less.
If this is supposed to be a criticism of him,
I just want to be a different person. I don't like being me anymore.
That hurts to hear, because I don't think that I don't think it's fair for you to not like the person that at least I'm talking to. I like the person I'm talking to. I think you're a wonderful person.
The way he's handling this is
Why do
pretty
you
much
think I
how you
think that?
would want him to handle this.
So what do you mean by happier?
I wake up and I don't want to kill myself. Thanks to you. Pretty
That's
sure.
a plus?
Yeah, pretty good.
Yeah, I mean that's a plus. I don't know. So I appreciate that. You feel I'm somewhat responsible for this. I'm grateful for that. I think, as I tell most people, we've spent 1 hour a week together over the last, 2 months?
You being there to guide me in the right direction, even if you just talk to me for 5 minutes, I could end up dwelling and thinking about it for one thing you say. I could think about it for 100 hours, right? For the whole every waking hour of the week, I could think about it.
Okay.
So we got 16 waking hours a day, 70 plus 42, 112 hours, right? 112 hours of therapy happening from one thing you say. I take it with me through the whole week, kind of thing.
Yeah, but that's the key thing. So that I'll accept in a moment. I'll agree with that. But I think the main thing here is that the work is not just what we do together. It's what you do in your mind after we talk.
I feel like everything in my life is coming together. And it actually feels like I have cheat codes on. It just feels like everything's working every time. It feels too easy. Everything's working. Anything I do just works. And then before, everything was really hard. Because a year ago, my mom and I were talking about doing a suicide pact and both dying. And now, everyone's happy. So,
is your mom happy?
My mom's happier now. I think she's happier because I'm happy. It's like a chain reaction.
You guys sound close. Sounds like.
Close emotionally, but we don't talk all the time. Yeah.
So, Reckful, is there something in particular that you'd like to talk about today?
No.
Okay. Then let me...
We probably are living in a simulation. Maybe I should just, should I get us out of here? Maybe the trick is that I need to die to get to the next part. There's another game.
Oh yeah, this...
Should I risk it and find
part.
out? No?
On July 2nd, 2020, after a number of attempts narrowly thwarted by his friends, Reckful killed himself. In the days prior, Reckful's friends reached out to Dr. K and asked him for advice. On June 30th, Dr. K was told that Reckful would voluntarily hospitalize himself on July 3rd. After Reckful's death on July 2nd, Dr. K told Reckful's friends to leave his name out of the account of Reckful's final days.
The conditional answer I'm going to give you is that if there's a suicide attempt and you're aware of it, you probably should commit the patient. And I'm not just saying that because it's like hindsight is 2020 kind of thing. We happen to know he died after. This is just what's done when people are standing on chairs trying to hang themselves.
Lose my oblivions. No.
My name is Awo Kanoja. I'm a psychiatrist practicing in Boston, Massachusetts. Welcome to another Healthy Gamer GG stream. Just a reminder that everything that we do on stream is intended to educate and support y'all, but nothing is intended to be medical advice. and I will say this now more than ever, that this is not a substitute for mental health treatment. A lot of people will reach out to me and say, Dr. K, I'll pay you whatever you want. I just want one session. And I want to make this clear that one session with me is not going to fix your problems. I know that's what people think. 6 sessions with me is not going to fix your problems. And yeah, I mean, what fixes problems is actual mental health treatment. And we try really hard to support people into getting that when necessary. Despite all of Reckful's, out of everything that he gave to us, I think at the end of it, unfortunately, he was fighting it alone, and he lost. But just because he lost doesn't mean that you have to. So what happens when a champion falls? He gave us so much. Like, I remember, being like a 20-year-old kid playing WoW and like watching his videos, and I was like, damn, that guy's awesome. Like, I wish I could be like that good at WoW. I was a fan. He was a friend of mine. And what do we do when a champion falls? Do we stop fighting? It's a personal battle and all of us have to fight it, but you have to fight it, but you don't have to fight it alone. So I've got a pretty big HP pool. I've got 100 hit points. I lost 80 of them yesterday. I lost most of my HP bar. And it's kind of like in a game when, so my HP bar is flashing and my UI is like red at the corners. So I can't take much more of this. And every time I work with someone, I give a piece of myself to them. And yesterday, the piece that I'd given to Reckful died with him. That's what happens.
Wait, what the fuck? Why? What the fuck is that choice to zoom in on the one asshole in chat saying scripted? What the fuck kind of editing choice is that? Oh, that's yucky. I don't know if that's like a MrGirl's personal choice or his editor's choice, but that's disgusting. That's actually disgusting. God, I hate this HP pool bullshit. People who play games are not children. I mean, sometimes they literally are, but not most. It makes me cringe, but that's not a reason to hate it. That's a reason to not enjoy it yourself. Like, I don't enjoy it, but that's not a reason to hate him.
Some of us died yesterday. And I need your help, and I need you to live. And I need everything that we do here to be worth it.
Blood is on your hands.
And I need you to get better, because I can't do this alone. I can't take much more of this. I need you to be better. I need you to be happy. I need you to find hope and meaning in your life, because that's what keeps me hope. I can't take much more of that, because I'm only human. I give a piece of myself to each and every one of you, and I give it willingly.
Literally, you put this clip into your video just to show that there are people in Twitch chat who are hating on him. What are we supposed to do? We're supposed to agree with them and think he's acting? Like, what's the idea? He's a fucking sociopath who manipulated Reckful into killing himself, just so he could put up a video of himself crying for clout. Like, what's the logic there? You can still think he fucked up. You can still think he was negligent as a therapist. But between that and believing that he's doing this on purpose is a huge fucking step. It's an insane step to go from that to what they're accusing there. And until now, this video was mostly just about his negligence. And like, you can argue that. You can agree or disagree with it, but you can argue that he was perhaps negligent. This is on a whole fucking other level. Showing this is actually disgusting. Like, the way it's being shown.
But I don't have that much left to give. I just can't, guys. I'm sorry. Thank you guys very much for giving me this opportunity to speak. And let's not let him down.
I'm really fucking disappointed.
You may
Mr.
have an
Girl,
innovative approach
just
that
for
you
that.
absolutely believe in, and the possibility is that you could be wrong. It's a little bit of a stretch to say, well, I know better than thousands of other people with my training and experience. But all of them are in one camp and I'm in another and I'm right and they're wrong. You know, there's a certain amount of humility and wisdom that needs to come from professionals. A good, solid therapy process in relationship is unlike anything else that we run into. It is something that involves the client going deeply into their thinking, their emotions, talking about their behavior. They will go to places that they have never gone before, and they will need a guide for that. And there is some real harm that can happen if they find themselves in a place that they didn't expect to be, they find some issues that they didn't expect to find, and then they don't have the support and help and the guidance to deal with that, to work with that, and maybe at times come out of that. And that can be so tricky that it is essential that licensing boards, for example, they know that. They know that their job primarily is to protect the public, is to expect professionals to be professional and to hold up the highest ethics with their clients. These are standards, these are aspirational issues, and the licensing boards must be.
The point is, he isn't taking this serious. The doctor that was interviewed just said to make sure they get to the hospital. You think he isn't taking that serious? He wasn't taking it seriously? Like, all I'm saying, Blue Goop, is there's a whole world of difference between accusing Dr. K of negligence, which there is a pretty strong case that some of what he was doing was very negligent from the perspective of someone who's supposed to be trained to know better, and to accusing him of not caring that someone he was supposed to take care of killed themselves. There's a huge leap between the two ideas. The point of what we just saw, zooming in to random Twitch chatters saying like disgusting stuff to Dr. K while he was crying, that was not the point. That was not to show that Dr. K isn't taking it seriously. That was to show that certain people believe that he's acting and that he's doing it for clout. What's the point of showing that, if not that? But yes, the doctor they interviewed just said that you should make sure someone in distress should go seek proper help. Yes. Though also, to be fair, earlier we tuned into Dr. K's stream. I don't know if he's still talking about the
but I also
his
want
rebuttal.
to reinforce that.
Okay, no, he's not doing dating advice. He did like a little explanation of his. He did like a little small answer. He did a little small answer to some of the criticism, and one thing he brought up, which, to be fair, like a lot of people say that like he should have referred people to proper doctors, etc., etc. He said that when he refers people to doctors, he considers that to fall under the scope of secrecy. That him referring. That he could have referred Reckful or any of the other people who consulted with him. He could have, and he says he did when needed, refer them to medical professionals, but that he will never talk about that on stream because he considers that to be part of the scope of secrecy, that of trust that people afford him, and that's a fair argument. Now, it is a bit weird considering you're literally doing therapy on stream to start talking about secrecy, but that actually is a fair argument. So he probably, we can assume, if we assume that he's saying that in good faith, then we can probably assume that he actually did refer people to medical professionals when needed. I think he took it serious. The gamer language is just a set of metaphors which come to him as second nature at this point. I think, yeah, absolutely. It's like it's his thing. I like I said, I don't like it personally. I think it's a bit cringe, but there's no, it's not wrong in and of itself. It's just my own taste.
Able to hold the professionals to a high standard, and if they don't, then people are going to be harmed, and that's the purpose of a licensing board, is to avoid the harm.
Ethics guidelines are there because at some point somebody got hurt, and at minimum you have to consult with a colleague. You have to consult with people to explore potential harms that might come. And sometimes we have blind spots. Sometimes we think we have great ideas and we might be missing a part of it that we haven't thought about. And to think that we have all the answers to something without running it by someone, specifically when it goes against an ethical guideline, it's arrogant. You're putting your clients at risk. Now, if you want to test something out experimentally, there are specific IRBs and internal review boards that you can go and do a study if you want to see if that actually can help people. So if you really do want to go and try out some new therapy, that's fine, but go and do it in such a way that minimizes risk to the people that you're working with.
That was the video? Oh yeah, that was the video. I'm very happy with this video. I liked it. I'm very disappointed with this video. I hated it. It's I'm actually disappointed. I'm sorry. It's like the like no comment type approach is one thing, but that one passage where he zooms in to the shitty comments in chat while Dr. K was crying, it fucking threw the video down in the shitter for me. Well, for someone claiming he had some major points, it's a serious disappointment, and it's a nothing burger. This is nothing new. Yes. So allegedly he's got a second video in the works, and that's the one with the actual news. But just the fact that he's milking this, he's making one video, he's like saying, I'm gonna put out new shit. Like I filed a thing with the therapist association. He might lose his license. He's stirs up this whole drama, this anticipation. A week later, this is what comes out, and it's nothing new. Is really scummy as well. And that scene where he zooms in on the chat messages, I'm not a Dr. K simp. Like the arguments that are made there about him being negligent, I actually support them. But I fucking hated this video. You're supposed to know that people weren't buying his story. That's all. Just the fact that there is concern. I think you're being very, very charitable with the reason you would put those kinds of comments in this kind of video. Yeah, I thought this was going to be the video, not a video of a series. Yeah. I like it because it doesn't give a strong argument in favor of the thing I disagree with. What was the specific thing you disagreed with, Dusda? How the fuck is Chud Logic scuffed video with less research time better? I don't know. Apparently there's going to be another video after, so, you know, I guess it'll be that. Yeah, I feel weird about this. Can I get a TLDR? I'm up to date as of last week. Literally nothing new. The whole video is about, well, the only new thing is interviews with other, there are videos on YouTube. Please watch it fully. Thanks. Shut up. Shut up. Let me milk YouTube. Okay, yeah. I'm going to put up the whole reaction video on my YouTube. Go watch it. I don't know what the point of the zoom in on those chat messages were. It seems like he implied that we should agree with them. But everything else I think was legitimate ethics complaints. Yeah, I agree. No, well, there was the one ethics complaint that I disagree with. It was the blonde psychiatrist. The blonde psychiatrist on the at the start of the video, she said that she was talking about how unethical it is when in a doctor-patient relationship you have codependence where the patient the doctor relies on the patient for some emotional support of some sort, and she compares it to something that parents do sometimes. It's a toxic behavior that some parents engage in, being like emotional vampires to their children. I have not seen an inkling of that in Dr. K's relationship with any of the people that he was doing therapy with. There were plenty of unethical things happening there, but that specific complaint, that was just out of nowhere. I did not see how that was related to the situation at all. The other ethics complaints I think are salient though. This is only about the Redfield situation. Yeah, obviously it was. Well, not only because there were some other other interviews, but yeah. The next video is about the Healthy Gamer Company. Well, we'll see.